Want to start? Good afternoon, everybody. So thanks for joining today on this Facebook Live at Apollo Hospitals. COVID-19 has taken everybody's attention, and hospitals, patients, doctors, everybody alike are just worried about COVID these days. But what I understand, and from the calls and the SOS messages and multiple consultations that I get these days, is women, although are the superwomen of our homes, of our society, are trying their best to make sure everybody at home remains healthy, remains strong with immunity to fight this pandemic. What they forget is the little problems that they are also facing. It goes at the back of their mind and continues to bother them, but they don't know where to turn around. So a lot of gynecological issues in women have actually become more than what they can handle today. And let me start with some of the problems, which I thought that all of you should be aware of what you could do and when you should not ignore it. The commonest problem that most of us are actually facing today is problem of abnormal bleeding. Now, this abnormal bleeding can take place either in terms of very heavy bleeding, a period is coming too soon, period is not coming on time, I'm menopausal but I'm bleeding, I'm a young lady but I'm not bleeding. So all these problems can take place. What I want to remind to all my viewers today is that you may have a problem of the first thing that you need to notice are you bleeding more than normal? Now, why are we worried about it? We are worried because if you bleed heavily month after month, you may slowly lose your blood and hemoglobin, become anemic, and then what you're trying to do for yourself and for your family, you may not be able to do it the best of your ability. So keep a track of what is happening to your bleeding. If you start bleeding more, if you're passing clots, if you're having any other issues, make sure you connect to a doctor. Now, today you can walk into a hospital. Most hospitals are today safe. They are trying their best to do all these protocols to make sure the patients who are not positive remain in the right areas. However, if you don't feel comfortable, we are always there for you, a phone call away, a video chat away, or anything. So connect to somebody. If you are heavy bleeding and you know that there is a problem, that means maybe 6 months back you were diagnosed for, say, fibroid or endometriosis or some infection, which you know is lingering along, but you have not yet taken care of in terms of definitive treatment like surgery or any other medication, you must take care that this bleeding is under control at the moment. Connect to your doctor. Make sure you find that window period to go and take the definitive treatment. Because this pandemic is not for a day or two or a month. It's a long haul. So we cannot ignore our other problems like this. The second most common problem related to bleeding is not getting periods on time or getting late. Now, this commonly occurs with patients who have problems like PCOS. I'm sure all of you are aware of something what we call as PCOD. Now, this PCOD is actually a problem that can occur to young women or middle-aged women or even elderly. This is a hormonal metabolic issue which actually bothers you. But I'll give you the silver lining. This is the time when you are most likely eating food from home, cooked. You have the time to exercise. So I cannot understand anybody telling, ma'am, I don't have time to exercise. You have time to exercise. So this would be the time where actually you can instill the lifestyle modifications that you need to make sure that you get into the right period cycle. And that is the lifestyle modification actually means only 3. And number 1 of that is actually change your diet. And when you mean by change my diet is actually, we just mean that you should eat home cooked food, which all of you are already doing. Add a little exercise to that, and you will find that losing 5% weight will be the simplest thing that you could achieve at this moment. So turn the pandemic or turn the fact that you are at home or lockdown or whatever into your positive, and so that you can take care of your health. So that's the second problem with the period that can be taken care of during the pandemic. You may also find that some patients are having some irregular bleeding. Now, this irregular bleeding often is a result of only two, or rather one thing, and that is a hormonal abnormality. Often the hormonal abnormality can be because of an internal hormonal abnormality, which can get precipitated by stress, can get precipitated by some hormonal abnormality that you actually are having, or it could just be a reflection of some problem like a polyp or endometriosis, hyperplasia, or some kind of cervicitis, which is now presenting as this. But the other thing that can happen in this kind of irregular bleeding is that you may be taking irregular hormonal from outside. So over the counter, a lot of hormone tablets are available, especially progesterone tablets, which we take to thinking postponing the period or something of that sort. But if we take it irregularly, can give rise to this irregular bleeding. So what happens? It's a cycle. It's a vicious cycle that develops. You take 5 days tablet, bleeding stops. You think, okay, I don't need it. You stop it. And because of stopping the bleeding, you get the period. So when you take the tablet again, and so for another 10 days, the period has stopped, we stop the tablet. So there is a system, or what we call as a withdrawal bleeding as well. So you may develop a withdrawal bleeding because of the tablets. So I would suggest that if you are having this problem, connect to a gynecologist, take the tablets properly so that you take it in a regulated fashion as we prescribe, so that you will not get this irregular cycle or bleeding that is often happening. So that's important to keep that also in track. So this is an abnormal bleeding which many women are facing, and you must not ignore it. You must not think that, okay, I will talk to a doctor or I will look after this when the pandemic is over. You don't know when it's going to get over. So we need to look after you, and you need to look after yourself for all this problem. The other thing that I would also like to actually bring to this forum is the problem of elderly women having bleeding after they have achieved menopause, which we commonly call as postmenopausal bleeding. Now, this is again the mothers or the grandmothers in the family at this moment are very concerned about their family, and they don't want anybody to get into any trouble or get into any kind of infection. So they don't want people to go out. They don't want them to go to the hospital. So they'll keep quiet about it. But remember that postmenopausal bleeding can be a sign of cancer. So one needs to connect to a doctor if you have that. And most often we may ask for a scan. We may like to do a small biopsy, and that's all it is. Again, all postmenopausal bleeding may not be a cancer. So about 80 to 90% of those bleeding are actually nothing to do with cancer. So they can easily be managed by medication, but we must be able to diagnose that 10 to 15 or 20% who are developing either cancer or the precancerous condition, and then take care of their problems. So this is very important to remember. So if you have an elderly in the family, as you're protecting them diligently from COVID or coronavirus, you must also make sure that if any of the elderly are having this kind of problem, not to ignore and keep quiet and think, okay, what shall we do? There are simple things which we can help you. So connect to your doctor and make sure that you have looked into it. So PCOD, as I said, is again an issue with all, especially teenage girls, young women. Again, we have also become a lot of sedentary. Now, the sedentary is also adding to our problem with gynecological issues. Now, you'll think, what is gynecology talking about sedentary? But you must remember that if you are not active, now, because a lot of us are doing online work, you are working from home. Children are working from home and learning from home on the online platform. So the activity that used to happen is coming down and down, and they are not really taking care of themselves that much. So it is very important to make sure that some kind of activity is inculcated in young girls who are in the teenage or early 20s, so that they continue to exercise and make sure their overall health and the hormonal release of whatever is happening in their body continues to take place in the regular fashion. The other thing I commonly get a question or a consultation for these days online or on the phone is when they are having some kind of pain or discharge. Now, vaginal discharge or infection can be a problem, which is can be seen. Now, vaginal discharge can really become a sign of infection, which needs to be treated. You cannot ignore it and leave it. The problem with vaginal discharge is many times you need to come to the gynecologist, because we need to see the patient to understand what type of infection it is and treat. However, there are limitations in the way we can treat them in telemedicine or treat patients with a distance where they are not able to come to hospital and they are wondering what to do. So there is also something what we call as a syndromic approach. So we can treat the vaginal infection by a combination of drugs, which is a short course drugs, and women can give you a relief. So suffering from vaginal discharge, itching, soreness, no need. Why are you suffering? Connect to a doctor and make sure that you are taken care of properly and you get the right medications. So vaginal discharge is again not to be ignored, especially three things again. If the vaginal discharge is associated with pruritus, if the vaginal discharge is associated with a foul smell, and certainly if the vaginal discharge is associated with some bleeding. So if you have a vaginal discharge with some kind of blood, make sure you reach a gynecologist so that they can look into your vagina, do a spectrum examination, and ensure to tell you whether they are dealing with some kind of infection or whether we are dealing with some kind of cancer. And there brings my point of Pap smear. So if you are having a vaginal discharge which is continuing for long, maybe doing a Pap smear may be a good idea. But yes, it cannot be done by distance. We have to do the Pap smear when you come to the hospital. So that's how we need to make sure that this problem is not troubling you. So we have to take care of our bleeding. We have to take care of any kind of discharge that's happening in a gynecological situation. The third thing that can actually bother most of you or actually bothers is pain. Now, this pain can be lower abdominal pain or it can be backache. So we are actually needing to worry about backache. A lot of query comes to me regarding, ma'am, I'm having a backache. Well, there are two things to it. One, there could be a cyclical backache. That means you are having the backache or lower abdominal pain along with your cycles. That is definitely some gynecological issue. And often these gynecological issues can be either infections or could be a condition what we call as endometriosis, or there could be fibroids in your, or it could be adenomyosis. There's some pathology which will give you pain during periods. Often the pain may start a few days before the period, continues through the period and may persist. So depending upon how the pain is associated with your periods, if the pain is also associated with some heavy bleeding, we need to actually understand that. Now, as I'm speaking about endometriosis, there's a question here which says an ovarian cyst can be considered as endometriosis. Yes, certainly. Endometriosis does present as ovarian cyst many times, but all ovarian cysts are not endometriosis, point one, and all endometriosis may not present as ovarian cyst. So if you have an ovarian cyst which has been diagnosed on scan and you are also having this pain associated with the bleeding, then it could be endometriosis. Now, endometriosis is a difficult diagnosis to make. We usually make it on a laparoscopy, but we have clinical clues to decide and tell you. Again, endometriosis may require surgery, for which you need to come to the hospital and we need to take care of you. However, in the stopgap treatment, there are many medications which a gynecologist can help you to relieve the pain or the bleeding associated with endometriosis. So don't ignore. Don't leave it for some time saying that, okay, fine, I will wait for 3 months, I'll wait for 5 months, because this is again a very common request I get. And they say, ma'am, we'll wait for 3 months. So fine, it's no problem. It's not a life-threatening situation that you're going to, you lose your life if you will not take care of it. But it's a debilitating condition. It will make you suffer every day with pain. So by the end of the day, you are tired, you don't want to take care of anything, you don't want to do anything. And if you are not well, everybody around you is not well. You're not happy, everybody around you is not happy. So it's important to look after your health. Extremely, extremely important, I would suggest. So we have to understand that these are chronic problems that can take place and that needs to be taken care of. Many times when we are talking about endometriosis, because there are some questions regarding it, it is also associated with infertility. Now, again, managing infertility or looking after infertility problems have again gone into a backseat right now. Because people are worried, they don't want to come out for investigations, they don't want to visit centers. But it is a nagging problem for couples who are trying to conceive, are not able to get pregnant. So they are bothered what to do. So it would be nice that if you could connect to your fertility specialist, go ahead and take the treatment, which could be intermediary for the time so that we could control you. I have another question. With fibrosis be cured with, I think they meant not fibrosis, but fibroids be cured by medication. A good question, because fibroids are very common in women and sometimes they are not having any symptoms, so that can be observed and not do any treatment. However, fibroids may require treatment basically in three situations. One, fibroid is big enough to cause any bleeding or pain to you. The fibroids are not letting you get pregnant, or the fibroids are increasing in size rapidly. In all the three situations, you need some kind of treatment. The commonest treatment we advise for fibroid and the permanent treatment we advise for is removal of fibroids. Either the fibroids alone, which is called myomectomy, or fibroids along with uterus, which is called hysterectomy. But many times we may decide not to do a surgery for the time being. And that could be the time right now. We have some medications in the market or in our armamentarium where we can give you to reduce the size of the fibroid. I think Mrs. Arora is asking this question. So these medications can reduce the size of the fibroid, can control the bleeding that you are having at the moment, but they will not permanently make the fibroids disappear. So we have to understand what is the size of the fibroid, how many fibroids you are, why are you looking for the treatment of fibroid, and then decide. But yes, some medications can be given temporarily to control the bleeding and make you feel comfortable. There is, once we talk about the fibroid, there are some questions regarding perimenopause. Correct. I think this is another area where women quietly suffer and don't understand what to do. So perimenopause, actually, to technically, if you'd ask me to describe it, it's few years before you start till you get menopause and a few years after. So that's the whole perimenopausal age group. This is an age group where women are between, say, 45 to 50, 55. Very busy. They have a whole family to take care, probably one generation above and one generation below, and they have no time for themselves. What can trouble them? The biggest thing that troubles them is the hot flash. And that is the sense of feeling hot suddenly and then cool. And that is what makes you so uncomfortable. So you may be cooking or talking on the phone or making your call on the phone, on your office call, and suddenly you are on that heat. Everybody else is comfortable. They don't want the fan and you want the fan. So these are hormonal imbalance that takes place around perimenopause and can be controlled by medications. If you approach to a gynecologist, you need not suffer in silence. However, must understand that slowly it will get under control. That means your body will adjust to it. The second thing, as I said, perimenopause will also give you rise to abnormal bleeding and periods, and that bleeding and periods again needs to be controlled by medication. Sometimes they can be a complete postmenopausal bleeding. That means you stop bleeding. For 1 year, if you stop bleeding, we call you postmenopausal. And any time after 1 year of amenorrhea or no bleeding, you bleed, it's a postmenopausal bleeding. Remember that postmenopausal bleeding always requires a gynecologist attention. It cannot be ignored because there is a small chance that at that stage, you could be developing a cancer. Why cysts happen in ovaries? Very excellent question. Now, cyst can happen in ovaries, three. Right? One we call as a functional cyst. That means every month your ovary forms an egg. The eggs get released. The area from where the eggs get released forms a small cyst, and that cyst disappears. Sometimes that cyst doesn't disappear and grows into a big size, and so that cyst is called a functional cyst. That kind of cyst requires just observation and it will go away in few months. The second type of cyst can be non-cancerous cyst, or what we call as benign cyst. Now, these are the cysts which could be anywhere from 5 to 20 centimeter size in your abdomen, and these cysts usually are silent unless they are hormone producing cysts, which can give you abnormal hormone or abnormal periods. Now, these benign cysts or non-cancerous cysts needs to be looked into, differentiate them from functional, because functional we don't want to do surgery. The benign cyst ultimately will need a surgery to remove. They can be cystadenoma, serous cystadenoma, or endometriosis, or any other cyst of that kind. The last type of cyst can be a cancerous cyst in your ovary. Usually it will be seen in a little elderly women, but young women can also have cancer of the ovary, and it can also run in families. So if you have a cyst which is persisting for some time, we can actually do some blood test called tumor markers, which can actually tell me whether the cyst is going towards the benign side or the malignant side. And then we will decide how urgent it is to operate. Sometimes, remember, this cyst, which is about 7-8 centimeters, can undergo torsion, and you can present with acute pain, and we need to do an acute surgery. So these are important things to remember. How can I consult you suffering from heavy bleeding? Okay, we at doctors at Apollo are all the time online available on Apollo 24/7 app. And anybody who wants can connect with us on this Apollo 24/7 video consultation app. So that's very clear. I'm sure you will get the information. How often should Pap smear be done? Okay, now there are many recommendations which were earlier, but now today the recommendation is that any woman beyond for 25 years sexually active should have one Pap smear. If it is normal, you can repeat after 3 years. There is no need to repeat two. There is also a question of doing a dual test, which is a Pap smear plus an HPV test. So if you have done this dual test and both are negative, you need to repeat after 5 years. So if you are doing only Pap smear, do it every 3 years. If you are doing a combination test, a combined test, you can do it after 5 years. How often should you do mammograms? And okay, mammogram again needs to, the two types. One, you can do a scan, that is ultrasound, and the one is the X-ray mammogram. X-ray mammogram is suggested to women only after 35 years of age, and the ultrasound is suggested to the younger women. If you have a family history of breast cancer, then you need to be more aware. And other than doing the mammogram, you should also remember how to do a self-breast examination, and you must do your breast examination yourself every month and get it done once a year by the physician. But mammogram can be done every 2 to 3 years, depending what the previous result was. If you are observing for some lesion, then it can be done more often. Otherwise, 2 to 3 years should be fine for you. How to increase weight of infant in 8 months of pregnancy? Excellent. So there's somebody who's logged out today who's also pregnant. So congratulations to you, Mrs. Jindal. Excellent. So you need to eat well, take rest, high protein diet, and that's the best way to increase the weight of the baby. So don't worry, it is after the 8th month, only between the last 2 months, that the baby's weight actually accelerates. So eat well, take rest, high protein diet, and I'm sure you must be supplementing yourself with iron and calcium. Take some B complex to increase. So that's the only thing you can do, and remain in good spirit and health, and remain positive. So there are questions with how to contact, and as I said, as of now, I am actually available at Apollo Hospital, Jubilee Hills, Hyderabad, but I don't know most logins are from Hyderabad or not. But across country, you can always connect with us at Apollo 24/7 app, and we will be able to, very happy to connect with all of you. In fact, it is very good to talk to all of you on the video consult these days, because for the simple reason that I can smile at you and you can smile at me. Otherwise, we are all behind the mask and nobody can see anybody's smile. So I'd love to connect with all of you on the video chat. After ectopic pregnancy, there is a chance for every month the patient gets pregnant, or okay. Now, ectopic pregnancy is again one thing which one must remember, and I would like to put a word of caution here regarding getting pregnant, early abortions and missed abortions and ectopic pregnancy. Now, it's excellent that if you at home do a pregnancy test and are confirmed as pregnancy. Good. Please connect to our doctor at that time and make sure what's going on and what you need to do. Second, if you confirm a pregnancy and don't want a pregnancy, possible, and you are justified in it, make sure you don't just take an over-the-counter medication for it. Why? Because if by chance your pregnancy is not inside the uterus and it's an ectopic pregnancy, if you take over-the-counter medication, it's not going to work in the pregnancy, and you will end up in a false assurance that you have taken medicine. The ectopic pregnancy may rupture and you may reach to a hospital in dire emergency. So make sure when you get pregnant that once your pregnancy test is confirmed at home, do a scan to make sure that you have confirmed that the pregnancy is inside the uterus, and then decide what you want to do, whether you want to continue the pregnancy, not continue the pregnancy. Take a gynecologist help to be able to do that properly. Now, chance of getting pregnant, if your other tubes are okay, then there is about 12 to 15% chance that you may have ectopic pregnancy in the next pregnancy. However, as I say to most of my patients, remember and be positive. Why can't I be in the 80 to 85% and not be in 15%? So if you remain positive, most often you will be in that 80%. And once we tackle this ectopic pregnancy, you will get a normal pregnancy. So remember that. There is a high likelihood that you will have that. I'm newlywed and I am 28 years old. I was diagnosed with PCOS 6 years ago. I was given Femilon then, but now again I have irregular cycle. No exercise. Okay, so Sukanya. Thank you for putting this question, and I really thought that somebody would ask this question. See, remember, PCOS is a metabolic condition, not a disease. Again, I will repeat this line. It is a condition of your body and not a disease. A disease, a doctor can take away, but I can't take away your condition, right? So if you have a condition, you must know how to control it. I, as a doctor, can only step in to give you some support, right? Now, by my saying that, it means that PCOD has a metabolic condition which has a link to diabetes. So everybody who has been diagnosed with PCOD and who is logging on today, just think, who in my family has diabetes? Definitely there will be one person. And that genetic link actually does not give you diabetes at this age, but can give you later. And this actually link is giving you abnormal hormones. So what can you do? Lifestyle modification is your bottom line. If you take drugs like Femilon or any other contraceptive pill for 6 months, 1 year, it will control and it will give you periods on time, which was the problem. But it's a false assurance to me that, okay, I'm good. But Femilon or any contraceptive pill is not giving you a long-term benefit. Okay, so that does not mean that if you take Femilon or any contraceptive pill for 6 months, your PCOD is gone and nothing will happen. No, it will not happen. It will only give you a false assurance of the problem till you are taking the tablets. There is no harm in taking for 6 months to 1 year because it controls many things. However, at that point, you should be counseled, and you must remember that you have to take the lifestyle modifications to have the long-term benefit. So remember the 3 things I mentioned before in my this Facebook Live also. Remember to take good food, change your diet. And changing diet, we have all understood in this lockdown period what to eat because we are cooking at home and eating, number 1. Number 2, exercise every day. When you do these two, a target to lose 5% weight. If you lose 5% weight, believe me, many of you who are having irregular period will start getting some periods in regularity. And I believe this particular person is also newlywed, so very soon you will probably be looking at getting pregnancy. So if PCOD, you control your weight, get your periods regular, you will get spontaneous pregnancy. But remember that if PCOD background, you are not able to get pregnant, then we step in. Then we step in to give you some drugs to get the ovulation properly so that you can get pregnant. When you are a little older, you may get abnormal bleeding. We'll step in again to give you some tablets to get the periods better. When you are a little older, you may get lipid problem or diabetes. You will have to meet somebody to get. So it's a metabolic disease or an error in your body, which can be there all along. So best is to catch it right now when you are young and make sure you make these lifestyle changes a habit. You have advised to go for laparoscopic oophorectomy surgery. Now, is it possible? Excellent. One of my patients asking that question. Yes, it is possible. We are just getting into our protocol study here in the hospital and trying to start the surgeries. So do connect to my office and let's see when we can schedule. Very useful information. Okay, excellent. All right, same. Okay, is it safe to use menstrual cups? Yes, it is safe to use menstrual cups, so that's not a problem. You can use anything that is either pads or tampons or anything that you can use during menstrual cups are also safe. All you need to remember is to maintain the proper hygiene, wash them properly, and to use it. Do we have any questions you have? Are you asking me any questions? No. Okay. So these are some of the things that we have been actually talking about. The other things that commonly come to us as gynecologists, which we are talking about, is regular aches and pains and weakness and things like that. Remember that the overall health is very important. It is not just the gynecological part, but as gynecologist, I wanted to bring some of these health issues which I deal as gynecologist. But I remember that when women come to me with these problems, this is only 75% of their problem. The 25% is low hemoglobin, low vitamin D, B12 is low, they are not eating well, there is sleep problem, they are anxious, they are worried. Many of them are also having some kind of clinical little bit of depression. So remember to identify these problems and nip them in the bud. Not paying attention to it, just putting them under the carpet is not what we want to do this. Okay, so we need to take care of it. Now, there are some other questions. Is it safe to get ultrasound? And at this time, is it safe? Apollo is giving appointment for ultrasound. Yes, it is safe to get ultrasound done because everything is done with protocol and with proper hygiene, with as related to the infection that is there. Yes, transvaginal scan can be done safely because every time we do, we change the cover of the transducer, and it can be done because transvaginal ultrasound gives the best information to a gynecologist to treat you in this COVID times, because Information on transvaginal ultrasound, I can plan your treatment for the next 3 to 6 months. Will the pregnancy after 30 be a normal one without complications? Why not? Why not? It will be a normal one without complications. So as long as you maintain the correct weight, your sugar levels are under control, you're not hypertensive. So make sure if you're around 30, that may be a good time to actually plan the pregnancy, because biologically you are in the right phase of time. So it should be all right. These days I'm having problem when I pee, it's burning. So what problem it should be, and please suggest. Okay. So when there is burning, when you pee, there are two things that can happen. One is you can have a urine tract infection, and that burning will be there the minute you start the stream. That means the minute you start your urination, it will be burning. So that is usually the sign of urinary tract infection. Can easily be diagnosed by doing a urine test. And if it is pus cells are positive, we give you antibiotics to control it. The other burning can sometimes be when you are having a severe vaginal infection, especially the candidal or the fungal infection, the thrush. Now that urine burning is generally towards the latter half, when you are towards ending your urination, and that's the time there's a lot of burning in that area. That can be associated with white discharge, and that can be treated by treating your vaginal infection. Okay, your method of explaining is nice, so that's good. Thank you so much. Best of luck. What precautions we take before delivery during COVID? Okay, so delivery is something which you neither can postpone nor we can ask you to come back later. So we are taking care of you all the time for deliveries. Remember, you have to take the same precaution as everybody else is taking. And in this COVID time, I actually thought I would actually also end this Facebook Live by saying, preventing is better. So let's try and prevent that we don't get this infection. That's the first focus. I think it's my focus and it should be your focus as well. And you need to, again, as I said, always 3 things are important. Here also 3 things are important. Make sure you wear the mask. And the mask is covered well, your nose and mouth properly. Okay. If you can get the 3-ply mask, it's fine. Otherwise, a 3-layered cloth mask is also fine. The first thing is mask. The second is hand hygiene. So make sure you are, and I actually say that again, we have to look for the silver linings. The silver lining is that such a bad and deadly virus goes away with soap and water, which is accessible from the richest to the poorest. If it was not going away with soap, imagine what we would have done. So you have soap and water. Make sure you keep washing your hand all the time. Teach everybody around you to do that. And the third, don't touch your eyes, nose, or face without cleaning the hand. So either with soap or water or with sterilizer or whatever you have. So if you follow these 3 instructions, because the virus is not going to just come from anywhere, right? It has to get into you through your nose, mouth, or eyes. So don't touch these 3 things without washing your hand. So that's the simplest thing we can do. How to sterilization menstrual cup? As I believe menstrual cups are just to be washed and dried. You don't have to do any sterilization there. So I think we are covering many of the questions. Okay, laparoscopic surgery. Yes, any minimal access surgery is actually what we would advocate in this time of COVID, not open surgery, unless there is a reason to do that, because we want you to recover fast. We want you to have least amount of morbidity. We want you to leave the hospital as early as possible. So laparoscopic surgery or minimal access surgery, which also includes robotic surgery, actually has the best advantage for patients. So if you are due for a gynecological surgery, you could connect to us, because we are doing minimal access surgery all the time. We also have robotic Da Vinci platform where we are doing gynecological surgery, probably the most number of cases over the whole country. So doing these surgeries or getting these surgeries done will give you the best result, quick recovery to your problem, and so that you can go home as early as possible. If we are taking any more questions, I could take more, or we could end the Facebook Live right now. So these are some of the points that I thought, and sometimes you may also have misfortune of having, say, something like misabortion in this COVID times, which is coming out, which many patients do connect with us. Again, missed abortion can be managed by 2 methods. One is we could give you some medication so that the uterus get cleared, or you need to come to the theater to get the whole thing cleared. So I'm really thankful for many positive comments that are coming also from many of people who are logged in. Thank you for giving your best wishes to us. We are trying our best as the medical community, not just the doctors, but the nurses, the technicians, the staff, the housekeeping, the F&B, everybody in the people who are here to treat or to take care of medical issues. It's a tough time for us as well. So I will not say that it's easy. It's a tough time for us as well. But as I said, somebody has to do it. So, and we are fortunate to be able to do it at the moment. So thank you so much for joining in this Facebook Live today. And I'm sure I answered most of the questions. I hope I have not missed some of them because they were coming at very, very fast interval. And we will still probably answer. If there are any more questions on the Facebook, if possible, I will answer those questions also. So should we end the Facebook Live right now? All right. So thank you so much for joining. Remain healthy, remain safe, and take care of yourself and everybody around. Thank you so much.